Parasites that crawl under your skin, burrow into muscle, and slowly destroying tissue from the inside out. Today, we're back with 5 more parasites that cause extreme pain, permanent damage, and in some cases, medical emergencies that ER doctors and infectious disease specialists never forget. All right, let's dive right in. Number 5, Myiasis, the flesh infester. Let's start with something deeply unsettling and very real. Myiasis is a parasitic infestation caused by fly larvae, maggots, invading human tissue. It's not one single parasite, but a category of infections caused by several fly species, and the severity depends entirely on which species is involved and where the larvae end up. One of the most infamous and medically feared is Cochliomyia hominivorax, better known as the New World screwworm. In higher income countries, myiasis is less common, but it still happens. Most cases are tied to neglected wounds, severe medical illnesses, homelessness, or breakdowns in basic wound care. But in tropical regions where flies like this still exist, exposure can happen fast, and damage escalates quickly. Unlike maggots that feed on dead or decaying tissue, this parasite feeds on living flesh. The adult fly lays eggs in open wounds, surgical sites, or even the umbilical stump in newborns. When the eggs hatch, the larvae burrow aggressively into tissue in a corkscrew-like motion, which is where the name screwworm comes from. Patients experience intense escalating pain, rapid destruction of tissue, muscle, and sometimes bone. And if left untreated, the larvae can erode through tissue and expose major blood vessels, creating life-threatening bleeding and a high risk of severe infection. As far as treatment is concerned, this is an emergency, and treatment requires immediate removal of all larvae, thorough wound debridement, irrigation, or cleaning out the wound, and sometimes combined with medications like ivermectin and broad-spectrum antibiotics to prevent or treat secondary bacterial infections. While general myiasis overall is rarely fatal, screwworm-specific myiasis can absolutely be deadly if not treated quickly. Number 4, Ancylostoma, the skin crawler. If you have a dog or cat, you're going to want to pay attention to this next one. Ancylostoma is a hookworm commonly found in dogs and cats, and its larvae are shed into soil and sand through animal waste. And in warm, humid regions, those microscopic larvae can survive for weeks, especially in places where people don't expect danger. This infection shows up all over the world, but it's especially common in tropical and subtropical regions like the southeastern United States, the Caribbean, Central and South America, and parts of Africa. And the reason people get it isn't risky behavior, it's normal behavior. The moment bare skin touches contaminated sand, the larvae penetrate the outer layer of skin. There's no bite, no sting. Most people don't even realize anything happened until later. A lot of people go down a rabbit hole trying to explain changes in their bodies. Sometimes it's parasites, sometimes it's stress, hormones, or genetics. For me, one of those changes was hair thinning. Even as a doctor, I couldn't ignore what I saw in the mirror, especially around the crown. For guys in their 20s, 30s, or 40s, that realization hits hard. I didn't want a pill or a list of potential side effects. I wanted something non-invasive and backed by real data, which is how I found the iRestore Elite. I mean, look at these results from their clinical users. We're talking about a 43% increase in hair count in just 4 months. The Elite uses 500 lasers and LEDs to deliver medical grade power, 2,500 milliwatts directly to the scalp. This light is absorbed by the mitochondria in your hair follicles, triggering a process called photobiomodulation. It essentially increases ATP production, the cellular fuel, which re-energizes dormant follicles and pushes them back into the active anagen growth phase. You're literally powering up your hair at a cellular level. I use it for 12 minutes a day while I'm charting or drinking coffee. The biggest change for me wasn't just seeing my crown thicken up in direct sunlight. It was the mental shift of not stressing about my hair anymore. If you want a drug-free, FDA-cleared option backed by real research, check out the iRestore Elite using the link in my pinned comment and use code DRER for a massive discount on your order. Humans are the wrong host for this parasite, which sounds like good news until you understand what that means fully. The larvae can't mature or move deeper into the body, so instead of settling, they wander just beneath the surface of the skin. The itching is severe and relentless. This isn't a mild rash. It's an itch that hacks your focus, your sleep, and your ability to think about anything else. People scratch until the skin breaks, and once the skin barrier is broken, the risk changes. Bacteria enter through those scratch marks, and what started as a parasite trapped in the skin can turn into cellulitis, abscesses, or infected wounds that take weeks to heal. Luckily, treatment is straightforward once the diagnosis is made. Anti-parasitic medications like ivermectin or albendazole stop the larvae. Can it kill you? Almost never directly. But this parasite earns its reputation because of how deceptive it is. It looks minor, it feels unbearable, and it can turn a relaxing vacation or a normal afternoon outside into weeks of infection, anxiety, and mental anguish. Number 3, Trichinella spiralis, the muscle invader. This next one doesn't crawl on your skin or announce itself right away. It waits, and by the time you realize something is wrong, it's already everywhere. Trichinella spiralis is a parasitic roundworm that humans contract by eating undercooked meat containing microscopic larvae. Pork is the classic source, but wild game is usually the main culprit, where many modern cases come from. And this parasite is found worldwide. Infections show up everywhere from Eastern Europe, parts of Asia, South America, and increasingly in North America among hunters. And unlike some parasites, you don't need poor sanitation or to travel to get one of these. All you need is just one bad meal. That's because once ingested, the larvae are released into your intestines, where they mature into adult worms. That stage alone can cause nausea, diarrhea, and abdominal pain. But that's just the warm-up. The adult worms release newborn larvae that penetrate the intestinal wall and enter the bloodstream. From there, they migrate throughout the body. They actively seek out skeletal muscle. That includes the muscles you rely on most, the ones that control your eyes, your jaw, your breathing, and your heart. Patients develop severe muscle pain and weakness that can feel like their entire body is bruised from the inside. Chewing becomes painful. Swallowing becomes difficult. They can invade the heart muscle, leading to myocarditis. This is the stage where patients end up in the ER. Treatment depends on how early the infection is caught. Can it kill you? Yes. Severe infections can lead to heart failure, respiratory compromise, or fatal complications from myocarditis and muscle breakdown. Even survivors can be left with chronic muscle pain and weakness that lingers for months or longer. Number 2, Onchocerca volvulus, river blindness. This parasite doesn't rush, it takes its time. And by the time people realize what's happening, sadly, the damage is already permanent. Onchocerca volvulus is transmitted by the bite of black flies that breed near fast-flowing rivers and streams, which is why this disease is known as river blindness. It's most common in parts of sub-Saharan Africa, but cases also get reported in Latin America and Yemen. The bite itself feels insignificant, just another insect bite. But inside that bite, microscopic larvae that enter the bloodstream and begin a process that can unfold silently for years. Those larvae mature into adult worms that live coiled together inside fibrous nodules under the skin. These adult worms can survive for over a decade. Here's the part that makes this parasite especially cruel. It's not the worms themselves that cause most of the damage. It's your immune system reacting to the larvae as they migrate through your skin and eyes. As the little parasitic offspring move, the immune response triggers relentless itching that patients describe as unbearable. Over time, the skin becomes dry, wrinkled, and prematurely aged, but the skin is only half the worry. When the larvae migrate into the eyes, the immune reaction turns destructive. Chronic inflammation damages the cornea, retina, and optic nerve. Vision slowly blurs, light becomes painful, eventually scarring sets in, and blindness follows. Can it kill you? Rarely directly, but blindness leads to loss of independence, increased risk of injury, and early death in affected communities. Number 1, Acanthamoeba, the contact lens nightmare. This final one terrifies doctors for a very specific reason. Like most good hospital horrors, it doesn't look dangerous at first, and by the time it does, it may already be too late. Acanthamoeba is a free-living amoeba found almost everywhere. Tap water, soil, air, you name it, and most people are exposed to it constantly and never know it. It only becomes a nightmare when it reaches the eye. This infection disproportionately affects contact lens wearers, especially those who rinse lenses with tap water, swim, or shower while wearing lenses. And what makes this especially unsettling is how normal those behaviors feel, right? Wrong, because once Acanthamoeba enters the cornea, it causes a condition called Acanthamoeba keratitis, one of the most painful eye infections known in medicine. Doctors see mild redness, maybe some irritation, but the patient is describing excruciating, stabbing pain, intense light sensitivity, and blurred vision. That mismatch is a red flag for medical professionals. The amoeba begins feeding on corneal tissue, and even worse, on the nerves of the cornea. It's that nerve involvement as to why the pain is so severe. Over time, a characteristic ring-shaped corneal ulcer forms, signaling deep, progressive infection. Can it blind you? Yes, permanently. And some patients lose their eye entirely. Acanthamoeba doesn't require reckless behavior or extreme exposure. It takes advantage of small lapses that feel harmless. All it needs is a microscopic opening in the cornea and a moment of access. There you have it. 5 more parasites you never want anywhere near your body. If this video made your skin crawl, but also taught you something new, hit that like button so I can keep making videos like this. And if you're curious to explore even more terrifying medicine, binge watch this full playlist right here. As always, hit subscribe, turn on your bell notifications, and let me know in the comments which parasite messed with your head the most. Thank you so much for watching, and stay healthy, my friends.